that, I'm going to introduce Martin because it's very hot. Martin Williams is the president of Psychedelic Research in Science and Medicine, PRISM, and also vice president of EGA, currently vice president of Entheogenesis Australis, and a researcher who's going to talk to us a bit about the psilocybin trial.
Yeah,
Thank you, Martin.
Sure. All right. Thanks everybody for coming out. It's fantastic to have you here, and thanks for coming to listen to our story, particularly in the heat, which obviously much more comfortable than yesterday, but still a little bit taxing. But lovely to see you all here. Thank you. Can you guys hear me okay? Yep, sweet. Thank you. I'll just sort of riff because I'm not doing slides or anything, so I hope you don't mind that, but I hope it sort of starts a conversation. And we're very, very happy to take questions at the end. And in fact, the shorter I riff, then the more time I'll have for questions. So let's go with that. I thought I'd just give a little bit of the background, the history to where we're at now. I think the timing of this conversation is pretty much perfect because we're very much at this sort of right at the nexus of counterculture and mainstream, and I think both of these concepts need to be explored a lot because clearly we've been counterculture for quite some time now, although the prehistory of psychedelic research and practice was very much within the sort of the mainstream culture. And now we're really finding ourselves in a very exciting stage whereby it looks as if we're pretty much knocking at the door of mainstream. And that's got attendant risks as well as the benefits. So I think we need to be aware of that. And the more we have these kind of conversations, then I think the better we'll all be able to navigate the path forward. So the prehistory to this research effort is Entheogenesis Australis, EGA. That was started. It came out of in fact, the Northern Rivers community back around 2002, 2003. And EGA started out by organising conferences every year from 2004 onwards, which brought together people who were interested in the many, many facets of psychedelics, effectively, whether it was plant culture and history, whether it was, ethnobotany, whether it was research, whether it was contemporary art, whether it was the music culture, anything else. So we really brought people in from many, many backgrounds. And over a period of about, let's say, 8 to 9 years, we had conferences every year. We started out in the outdoor space. We had 2 to 3 conferences within Melbourne CBD itself, generally at the Uni of Melbourne. I apologise if you already know this history, so just bear with me for going over it again. But at that time, I think we grew the awareness of psychedelic culture and the potential for psychedelic therapeutic research as well and clinical practice over that time. And that really sort of culminated in a conference in 2010 when Rick Doblin from the Multidisciplinary Association for Psychedelic Studies came over from the US as our guest. We had a little forum afterwards, and we really felt that in Australia we had the potential to get in start research to try and change things so that we could eventually move towards clinical practice. I hope that that you will, if you don't agree directly, then you at least would be open to the argument that psychedelic psychotherapy has a potential part to play in mental health treatment in Australia and around the world. So I'll sort of start with that as a premise, okay? So I'm very happy to converse over that later, but I'll just sort of take that as more or less something that we probably generally agree upon. I'm happy to say that the research that's been taking place in the meantime has reinforced and supported that contention. So from 2011, we decided to set up a new organisation, PRISM, Psychedelic Research in Science and Medicine, and many of you will be aware of that history because I've spoken about it a couple of times in the last few years here at Rainbow. But at that time, I feel that we were still very much part of the counterculture, and the whole idea of psychedelic medical research and practice was not the sort of thing you would bring up at the dinner table, for example, or with your family, or just in company that you didn't know well. And so very much in the intervening time, so between 2011 and 2016, we had a couple of cracks at getting research proposals put to ethics committees in Australia, both in Melbourne. Both were knocked back, one by the ethics committee itself and the other actually by the university administration, because it just didn't want to be bothered with the risk of promoting psychedelic research, which they actually stated, wrongly I have to say, was promoting illegal activity. It's stated perfectly clearly in the schedules, the Schedule 9, which is the highest level of restriction of psychedelic drugs or drugs generally in Australia, that these drugs can be used in research, in clinical and medical research. But that was overlooked by the university at that time. I'm happy to name and shame, it was Deakin University in Victoria. I hope they will live to regret the error and their lack of wisdom in that decision. But really things have come around, and I feel that I've sort of likened it from time to time as sort of starting to ride the crest of a wave, which is obviously has its origins in other places. So like no wave suddenly crashes on the shores of Australia without having started somewhere else. And so we are the great beneficiaries of the preliminary steps that have been happening over quite a long period of time. Primarily in the US, but also significantly in Switzerland, in Israel to a degree, in the UK and Canada in particular. And so what that has really done in the meantime has brought around the public discourse, the conversation, so that psychedelics gradually, but increasingly now, have been demystified and destigmatized. As more and more people are just coming to realise that the word psychedelic is simply, it's a very non-threatening, quite innocent word. It just means mind manifesting. And anybody, as I would hope a few people in this audience might have experienced, there's a certain mind manifesting element to the psychedelic experience. And so that's really what it's all about. And that really is the origin also of the therapeutic potential of psychedelics. And so the conversation had been started overseas. Australia, unfortunately, has been rather late to come to the party, but the party seems to be starting now, I'm happy to say. So within the last year, pretty much very much as a consequence of the EGA 2017 conference we had out in near Eildon, northeastern Victoria, that really brought together some clinicians who are working very much at the coalface of mental health practice, and these people are with us. Two of them are with us in the audience today, and also some funding partners who were very interested to support psychedelic medical research because they already had become convinced of the potential. And so it seemed to me that the stars were aligning really quite beautifully. And although our initial interest had been in studying MDMA for post-traumatic stress disorder, and that had been the theme of our first two efforts to get clinical research underway in Australia, it has ended up being psilocybin, which is something that I'm sure is very near and dear to many of us, as an adjunct to psychotherapy for people facing end-of-life anxiety and depression. And so it's been quite an intense year of work to work towards getting the protocol formulated, get that approved by the ethics committee of the hospital in Melbourne where the research was planned to take place. And then we've been moving gradually through the state and then soon to be the federal levels of approval. But I'm happy to say that we're very, very close now. Yeah. So I think the way ahead now is to get the research underway. It's going to take a good couple of years for this to be completed and then communicated. And during that time, I think I can comfortably say that this conversation will continue to evolve so that we're less and less a part of the counterculture and we're more and more representing the mainstream discussion. Now, the mainstreaming of psychedelics has become quite an interesting theme and rather a contentious theme of conversation globally. And I don't know who among us here has actually taken part actively in this conversation, but certainly there are plenty of people who have been involved in the psychedelic space on a number of levels for a number of years who, quite frankly, can't really see the merit in bringing psychedelics into the mainstream. And I think this is a topic that really we ought to be thinking very carefully about, because it's something that we can all contribute to. And for those people who do have significant reservations about bringing psychedelics into the more public discourse, and ultimately we hope to have them accepted within the sort of the framework of mainstream medicine. I really feel that we need to listen to those voices and very carefully take into consideration what they have to say. And so I would encourage you, particularly right now and during this panel, to please to air any concerns that you might have. One thing that I guess I can say is that mainstreaming is likely to involve, unfortunately, we probably, a lot of us would hate this concept, but it ultimately will involve the commercialization in some way of psychedelic clinical practice. Now, whether that involves some sort of protection of IP, of intellectual property, whether it just simply involves bringing the medical application into the public health system, which I would suggest is a very reasonable and hopefully very palatable way to go forward. Nonetheless, I think that there's plenty of potential for A, psychedelics to have a place, B, for them to be broadly, widely, and very positively adopted in our medical model. And I hope that I hope that the conversation continues in a respectful and positive manner. So I'll leave it at there for the moment. I believe that Melissa will be up in a sec to continue what I've been mentioning and sort of talk about a couple of new developments as well. And I look very much forward to having the conversation as the panel concludes. So thank you very much for your time and your interest.
Before you finish up, Martin, because I know it's a question that was burning around the social media pages when the reporting of the psilocybin trial came out, and people noticed that word synthetic psilocybin, and people got very upset. Can you explain to us what synthetic psilocybin is and why a synthesized version is used in research?
Hands up who's upset by the concept of synthetic psilocybin. Cool. One of the realities of clinical research in humans is that any drug that's given to humans must be produced by according to the framework of what's called good manufacturing practice. And so this is whether we like it or not, this is the standard medical model for having any new drugs approved for clinical use. And unfortunately, harvesting, even cultivation, which is difficult enough, but harvesting, extraction and purification of psilocybin from raw material is not a permissible way to obtain psilocybin for these clinical trials. So that's just the unfortunate reality. So we have to make that compromise at this stage. To use psilocybin, which has been synthesized in a pharmaceutical facility which has been approved. It's an extremely expensive process to have a facility such as a laboratory approved for good manufacturing practice. Ultimately, I guess we would hope, and this is something that I can't really comment on to any great degree right now, is that the current model of mainstreaming psychedelics for medical application will involve legalization and incorporation of the drugs into the framework that already exists. It'll involve the rescheduling of psilocybin and potentially mushrooms, the raw material themselves, which I fervently and deeply hope will take place, into a less restrictive category of regulation. So synthetic psilocybin is chemically identical to psilocybin that would be extracted from the raw material, from the raw biomaterial. One advantage of using synthetic psilocybin is that it can be produced as a pure product which can be dosed accurately, and its therapeutic effects can be characterized very, very carefully and accurately. The raw material, or psilocybin that is extracted and purified from mushrooms, is likely to contain a couple of the precursors or the intermediate compounds in the biosynthesis in the mushroom of psilocybin, and those are called baeocystin and norbaeocystin. And they simply differ from psilocybin in the lack of either one or both of the methyl groups, which are the two little end bits on the psilocybin molecule. But they may or may not have an appreciable neuropharmacological effect that we just can't characterize at this stage. So at this early stage of research, we have no choice. We have to use synthetic psilocybin. But what I would say is that for the people who do have concerns, I would be very interested to know if anybody has ever been in a position to compare the effects of synthetic and naturally extracted psilocybin, let alone synthetic psilocybin and raw or dried mushrooms. Okay, so I'll just put that to you as a little bit of a challenge. I'm fully aware, cognizant and respectful of the issues involved, and I do respect the conversation that's taking place and the concerns that people might have.
Thank you, Martin Williams. If you want to find out more information about what PRISM do, the website is prism.org.au, and it's got lots of information on there at the moment about various different research proposals and a lot of local news that's been, because there's been a lot of news about PRISM over the past 12 months.
There has indeed.
Yeah.
The announcement. Sorry to keep interrupting and interjecting, but the announcement of the clinical trial at St Vincent's Hospital in Melbourne, St Vincent's Public, was just under 2 weeks ago on Tuesday, the whatever the date was, around the 15th. It was the 15th. And there's been a great deal of very overwhelmingly positive media coverage of all of this, and so I'd like to thank and pay great respect to the collaborators that are with me in the trial, and thank them very much for their involvement, and thanks St Vincent's for making this all possible. So. And also thanks to our funding partners. The other quick plug I'd like to make is just that EGA is continuing to organise conferences, and we're having smaller events for the next year or two until our main conference comes up again in likely to be December 2020. But in 2019, which last week they told me was this year, we will be having an EGA event on the 12th of May is the date that we're considering at the moment. And the theme will be Garden States, and this will be more of a focus again on ethnobotany and plant culture and so on. So I would invite you all to be involved, to come along. You can pick up flyers for EGA, I think here in the space, but also at the APS, the Australian Psychedelic Society market stall, which is down at Y7, I believe, down in the market area. So I would invite you all and strongly encourage you to be involved with EGA. We'd love to have you involved.
I think you can find a mailing list at entheogenesis.org, so you can sign up there, and you'll find and the usual social media channels, and YouTube. Their YouTube channel has a number of talks from previous years. I think there's about 100 videos, Ronnie. I'm guessing 80, but it's going up all the time. There's more and more. Check them out, high quality. In fact, we were looking through it, and there's only a couple of other channels that have that many good talks on psychedelics. So that's youtube.com/EntheoTV. Now, Melissa Warner, who is the Executive Officer of Mind Medicine Australia and the co-founder of Australian Psychedelic Society. And Melissa is hosting Professor David Nutt in Melbourne. And David Nutt was infamous for, I think it was 2010, he was the head of the UK government's advisory.